So S2000 is a cooperative group study through SWOG, part of the National Cancer Institute, and it's a randomized phase 2 trial for patients with symptomatic melanoma brain metastasis, randomizing into a triplet regimen of Encorafenib, binimetinib, nivolumab versus combination immunotherapy with ipilimumab and nivolumab. So for this study, we focused on patients with symptomatic melanoma brain metastasis. The reason being that these patients do very poorly with immunotherapy treatments, even with ipi-nivo. Typically, less than 20% with immunotherapy have treatment response. Usually, their progression is, just over 1 month. So, unfortunately, very poor outcomes, probably because of oftentimes they require steroids and have a lot of symptoms from their brain metastasis. So in this study, these patients with symptomatic melanoma brain metastasis whose melanoma had a BRAF V600 mutation to be eligible for enrollment were randomized to either a combination of immunotherapy and targeted therapy. So that's the Encorafenib, binimetinib plus nivolumab, or to standard immunotherapy with ipilimumab and nivolumab. And then our primary endpoint was assessing them for overall progression-free survival. So that's either intracranial within the brain or extracranial, so overall PFS. And what we found was that the group of patients who are randomized to the triplet regimen, that's the targeted plus immunotherapy, actually had improved progression-free survival. So the study met its primary endpoint. And the 6-month PFS rate was above 50% versus about 20% with the ipi-nivo. And further, in the patients, when we look specifically at intracranial PFS, there was even more of a difference. Median PFS was 8.7 months versus about, with the triplet versus 1.5 with the ipi-nivo arm. Similarly, our response rates were also much higher. It was about 75% with the triplet arm intracranial response versus about 15% in the ipi-nivo arm. So it looked like there was a benefit in response and improving progression in patients getting the triplet Encorafenib, binimetinib, nivolumab regimen versus ipi-nivo for symptomatic melanoma brain mets. So these group of patients, again, very hard to treat with symptomatic melanoma brain mets, very poor outcomes. So we think that possibly a triplet regimen, right, if their melanoma has this BRAF mutation, a triplet regimen of targeted therapy plus immunotherapy may be a therapeutic option for them, as opposed to starting them on just immunotherapy alone. But I think this approach would need to be explored in, probably larger studies and also be compared to, sequential targeted therapy, immunotherapy designs. But we think that this may present another treatment option for currently a very challenging to treat patient population.